Welcome, everyone. As pharmacists, we know we're on the front lines, and today we're diving into a topic that is just so critical: diabetic foot infections. This explainer is all about equipping you with the essential counseling points, the things that can truly change a patient's outcome. So let's jump right in. Let's not mince words here. The stakes are incredibly high. What might start as a tiny, unnoticed scrape can spire, and I mean fast, into a full-blown medical emergency. For our patients, this isn't just an infection. It's a real and present danger to their mobility, their independence, and yes, even their life. And that right there is where we come in. Every single time a patient with diabetes comes to our counter, it's a chance to screen, to counsel, to educate. We are a vital safety net. The whole point of this explainer is to give you a clear, confident framework for having those conversations. Okay, so first things first, let's really break down the problem. It's not just about a bug getting into a wound, no, it's about the unique and frankly dangerous environment that is the diabetic foot. You see, it's really a perfect storm. Because of neuropathy, a patient might step on something sharp and literally not feel it. At the exact same time, peripheral vascular disease is choking off the blood supply, so the body can't even heal itself properly. That deadly combo is what takes a small problem and turns it into a disaster, leading to things like deformity, amputation, and a massive hit to a person's quality of life. So, knowing all that, what's our active role? Well, it all starts with one thing: recognizing the red flags. Honestly, this might be the most important thing we can do. Here's a super simple 4-step tool you can use every day. First, just listen. Are they mentioning any new pain, any drainage, or a strange odor? Second, look. Can you see any redness, swelling, or discoloration? Third, ask about their blood sugar. A sudden, unexplained spike in glucose can actually be one of the first signs of an infection. And if you get a yes to any of these, step 4 is non-negotiable. Advise them to get medical help right away. Okay, now we're getting to the heart of our expertise: counseling on the actual medications. This is where we really shine. So when we're talking about initial antibiotic therapy, it all boils down to severity. If it's a minor, localized thing, we're mostly worried about basic gram-positives like staph and strep. Simple oral drugs usually do the trick. But as things get worse, the bugs get nastier and more diverse. We have to start worrying about anaerobes, other gram-negatives, and that's when you see broader combos, IV therapy, and for the really severe cases, hospitalization with an eye on MRSA. And this brings up a classic clinical question, right? One we're always thinking about. Do we need to pull out the big guns and cover for Pseudomonas? It's a tough bug, but we also don't want to overtreat. Well, the short answer is probably not. For most of these infections, you don't need to add empiric Pseudomonas coverage. The big exception, the one thing you really need to ask about, is a history of foot soaking. That warm, wet environment is like a playground for Pseudomonas. Now for a huge counseling point: adherence. Look, a simple skin infection might be done in a week or two, but if that infection gets into the bone, osteomyelitis, that patient could be on antibiotics for months. We have to stress how absolutely critical it is to finish that entire course to stop this thing from coming back. All right, let's drill down and get into the nitty-gritty. Here are some quick, key counseling pearls for the antibiotics you're going to see over and over again.
First up, the fluoroquinolones. You know them, you see them all the time. They work well, but boy, do they come with some important safety baggage.
Your mental checklist for these should have 3 non-negotiables. First, photosensitivity. Tell them to stay out of the sun. Second, the classic drug interaction. Make sure they separate it from antacids, iron, calcium, any of those metal cations by at least 2 hours. And finally, that rare but serious one, tendon rupture. Tell them any new tendon pain, especially in their heel, is a sign to call their doctor immediately. Next up, clindamycin. It's a great drug, especially for gram-positives and anaerobes, but it has one really, really significant side effect we have to talk about.
And the big one is C. diff. Every single patient getting clindamycin needs to be counseled on the high risk of diarrhea. And this isn't just a little upset stomach. You have to tell them that severe, watery diarrhea is a reason to call their doctor, no questions asked.
Now, for suspected MRSA, you're usually looking at linezolid or vancomycin. The big difference for us? Linezolid has that awesome oral option, which is great for sending patients home, but it means we have to be super careful screening for interactions with SSRIs and other serotonergic drugs. Vancomycin, on the other hand, is IV only, and it's all about that careful lab monitoring to make sure we're hitting our targets without hurting the kidneys.
And finally, let's talk about our go-to for anaerobic coverage, metronidazole.
3 quick points here. First, prep them for that weird metallic taste. It's common but totally harmless. Second, and this is an absolute must, no alcohol. Not during therapy and not for a few days after. That disulfiram-like reaction is brutal. And third, for patients on it long term, just be aware that painful neuropathy is a possibility.
You know, curing an infection is obviously the immediate goal, but our real goal, our ultimate value, is in prevention. It's about empowering our patients so this never happens again.
This right here is your patient education toolkit. Daily foot checks are everything. Simple habits like cutting toenails straight across, never ever walking barefoot, and testing bathwater with an elbow can prevent that first injury. And I want to call out one that might surprise your patients. Tell them to avoid foot baths. It sounds nice, but it can soften the skin too much, maceration, and make it way more likely to break down.
And of course, we always have to zoom out and connect it to the big picture. All the foot cream in the world won't matter if their blood sugar is out of control. And smoking just strangles the circulation they need to heal. We have to reinforce these bigger goals every chance we get. So I'll leave you with this to think about. How can you build these quick checks into your daily flow? Whether it's just a quick, how are your feet doing during a refill pickup, or a deeper dive during an MTM, making foot care a routine part of the conversation can save a limb. And sometimes it can even save a life. Thank you.